Today, we will study about the tuberculosis. Tuberculosis is an infectious disease caused by a bacterium that mostly commonly affected the lungs. Causative agent is Mycobacterium tuberculosis. There are 70 different types of mycobacterium. Currently, it kills 3 million people a year and would claim up to 3 million lives if not controlled. The scientific name of the TB microbe is Mycobacterium tuberculosis. A microscope, it has a long red-like shape or bacillus. The thick weakly cells wall allows the germs to spread through the air in water droplet.
Mission of the TB, tuberculosis. TB is spread through thinly drop spread into the air when the infected person coughs, sneezes, or speaks, or another person breathes the air into their lungs containing the TB bacteria. Not all the TB infection lead to TB disease. Latent TB disease or TB infection occurs when the immune system has contained TB bacteria and prevalent disease. Active TB disease refers to the time when TB breaks out and causes disease.
Now, the latent TB infection. TB bacilli lives dormant inside the lungs but do not cause disturbance in the organs. No sign or symptoms of disease, not infectious. That the TB diseased. TB bacilli progress involve and damage the parts of the body. Signs and symptoms of the disease appears can be infectious. In HIV positive person, the body immune system usually keeps TB infection under control. Only 5 to 10% of LTVI, latent TB bacilli infection, cause progress to active TB during their lifetime. People living with HIV with LTVI have a 5 to 10% risk of developing TB disease each year. In the TB disease, the tuberculosis can get any time and make a person sick, usually within 1 to 2 years. And the more likely to get the TB disease when a person's body is weakened from. These are the disease which the tuberculosis can cause immediately or get the HIV patient have more opportunity to becoming a tuberculosis. In diabetes also, for example, in poor nutrition, cancer medication, steroid, if the person use haphazardly steroid use, then the chances of tuberculosis is caused. And then the drug use and drug abuse person, smoking, and the old age. Now, the types of tuberculosis. And what are the types of tuberculosis? There are mainly divided into two types. There are two types of tuberculosis, and according to their site of infection. One is pulmonary tuberculosis and extrapulmonary tuberculosis. And pulmonary tuberculosis denoted with the lungs. The TB infection caused in the lungs is denoted as the pulmonary tuberculosis, and extrapulmonary tuberculosis means which are caused in the other parts of the body. For example, lymph node tuberculosis, bone and joint tuberculosis, pericardial tuberculosis, pulmonary tuberculosis, tuberculosis meningitis, abdominal tuberculosis, and genitourinary tuberculosis, and the skin tuberculosis. These are the types of the tuberculosis. The pulmonary TB. It the most common form of TB disease and in the infectious form. The damage caused by the pulmonary TB expand plus containing TB bacilli into the lungs, which the person with TB may cough off in spit or sputum. Disease involves in the lungs tissue, and the pulmonary disease there are two types, which are semer-positive and semer-negative. And what is mean by the semer-positive and what do you mean by the semer-negative? The visible TB bacilli in the sputum are infectious, and the semer-negative means no visible TB bacilli in the sputum, less infectious. Now we discuss about extrapulmonary TB. It is an normally range but occurs in up to 40% of the TB caused along with the people living with HIV. Disease involving an organs other than the lungs includes pulmonary TB, not infectious unless also have pulmonary TB. Sign and the symptoms of the TB disease. Due to the general infection, the immune response, the most of the person and all the persons, the immune system is the main role of the any disease. The immune system involve the and which the immune systems are strong, the chances of disease will be less, and the immune system which person the immune system is low and the immune system responds the low, then the disease can be caused. Whatever that, the sign and symptoms of the TB according to the response of general infection and the immune response. For example, fever, night sweating, weight loss, and due to the direct damage, the TB can be the damage directly. For example, the pulmonary TB, cough. If the tuberculosis damage the directly part of the body, then the system that the pulmonary TB like lungs, right, related to lungs, then what are the symptoms? That is cough, sputum, like the sputum of color may be white, gray and green or red. Extrapulmonary, we have to study already that extrapulmonary means other parts except lungs. For example, it depending upon the site of the infection, which part of the TB can be occurs. The people living with HIV develop symptoms late and are less likely to present with coughing. If the TB can be caused, then the investigation can be done. For example, the X-ray can we have to done. In a chest X-ray, The patient present the recent skin test convulsion and is to suspended of having TB. The chest X-ray is normal. Then the chest X-ray is normal. The further diagnostic test cannot be necessarily, or the further investigation cannot be done. But if the chest X-ray saw sign of the disease and sign and symptom, the further diagnostic test will be confirmed for the TB disease. The second one diagnostic is the sputum culture. Sputum culture from specimen is necessary to confirm that the TB bacteria is presented in the lungs. The sputum semen should come from deep within the lungs, and the first cup of sputum of the day for 3 convulsive days may be obtained through special respiratory therapy procedure. Now, why we did the treatment and the aim of the treatment? The aim of the treatment of tuberculosis are to cure the patient and to maintain or to restore the quality of life and their productivity, to prevent the death from the active TB or its late effect, to prevent the replace of TB, to reduce transmission of TB, and to prevent the development and transmission for the drug resistance. We have to study the tuberculosis and their types of tuberculosis, sign and symptoms of tuberculosis, introduction of tuberculosis, and finally we have to study about the drugs of the tuberculosis. What are the medicine or medication or drugs used in the anti-tuberculosis? In this blue circle color, under the blue circle color, these are the drugs which are used for the anti-tuberculosis: isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin are the drugs, first line drug. And in the black color, under the black color circle, these are the dose and range of the drugs or medication. And in the red color, the dose and range according to body weight, mg per kg body weight. And in yellow color circle, the daily maximum dose of the drugs. Another treatment of the tuberculosis is DARS, the DARS method. And what is DARS method? DARS method is the direct absorption of therapy, involved to providing the anti-tuberculosis drug directly to the patient and watching he or she swallow the medication. It preferably course the management for all the patient with tuberculosis. Priority situation for the use of DOT. What are the priority situation for use of the DOT? Number 1, patient with flowing conditions like pulmonary tuberculosis with positive spectrum smear, treatment failure. If the treatment is failure, drug resistance, HIV infection, previous treatment for either active tuberculosis or latent tuberculosis infection, current or purity substance abuse, psychiatric illness, memory impairment. And number 2 is children and adolescent. In the first line class of drug, an anti-tuberculosis classification drug, the children or adolescent may not be used, but the DER therapy is used for the children and adolescent. After that, the combination chemotherapy. The primary goal of anti-tuberculosis chemotherapy are to kill the tuberculosis bacilli rapidly, prevent the emergency of the drug resistance, and eliminate persistence bacilli for the host tissue to prevalence. The multiple anti-tuberculosis drugs used to taken for the sufficiently for long time. Thank you for watching this video.